And now we will move to Representative Bennett. Representative Bennett, would you prefer to take these in any specific order, or shall I just go exactly how they appear on the calendar?
You can go as they appear in the calendar.
Thank you, sir.
Whatever you feel good with.
Okay, so we're going to move on to House Bill 5153 by Representative Bennett. This is an act relating to human services regarding the Rhode Island Pathways Project. This will require the Executive Office of Health and Human Services to conduct a study to assess the impact of using medical funds to provide coverage for treatment of the chronically homeless. Representative Bennett, you have our attention and you have the floor. Please go right ahead.
Thank you, Mr. Chairman, fellow members of the committee. I will be brief. We all know the problem we have with homelessness here in Rhode Island and across our nation. I've been working with the Homeless Network to come up with a good bill. I'm sure we'll probably be changing this one. But as it stands now, this would allow the Executive Office of the Health and Human Services to utilize any current Medicaid waiver funds to provide coverage in supportive housing for the chronically homeless population in our state. Pursuant to 40-8-17, the EOHHS is directed and authorized to apply for and obtain any necessary waivers, waiver amendments, and/or state planned amendments from the Secretary of the United States Department of Health and Human Services that will ensure the individual who are homeless have access to housing and supportive housing services. This population is a tough population to work with. They do not stay in safe places, the ones that are on the streets. They're very vulnerable to different crimes, and we need to take care of them. We need to help take care of them. There's various reasons people are homeless. It can be from loss of job. It can be from substance abuse. It could be a number of things. But we need to show our support for them and help them at least find safe housing. Thank you.
Thank you, Representative Bennett. Chairman Bennett, I'm sorry. Are there any questions for Chairman Bennett regarding this legislation from the committee? Representative Kassar, go right ahead, please.
Thank you, Mr. Chairman and committee. Thank you, Chairman Bennett, for this legislation. Just wanted to ask if there are other states that are currently using their Medicaid funds for the housing portion for the chronically homeless. Like, is there already a model and we're just looking to replicate that, or is this something new?
I have no idea. I don't know. This bill was given to me, and I'm doing what I do, presenting it to the committee and hoping for passage. As far as other states doing it, maybe one of my witnesses will be able to answer that.
Okay.
But I'm not going to try to sit here and make something up to make it sound good. But
okay.
Thank you.
Thank you.
Thank you. Are there any other questions from the committee for Chairman Bennett? Okay, thank you very much. We're going to try, we did try for our verbal witness. We're going to try them again. I will notify you that for House Bill 5153, we have two people who have sent a written testimony. One is Bob Cooper from the Governor's Commission on Disabilities. Bob actually has a proposed amendment which he sent forth to us, so you can all review that, as well as Chairman Bennett. You can take a look at that verbal testimony, the written testimony, and Jordan Goyet, who is also in favor of the bill. Do we have our verbal guest? Okay. We've already given our verbal guest, Gregory, a shot. I don't want to butcher his last name, but I think it's Wexmolsky. Okay, so we cannot reach Gregory. We did try him twice for a verbal testimony. He is in favor of the bill. If he does call back prior to the end of this hearing, I will entertain his excuse me, I will entertain his testimony.